Well, today on the show, we're back at the Physical Therapy Center of Ocean Springs talking to Doug Roll. It's been a while. How are you? It's good to see you.
Good to see you. Glad to have you back.
Well, thank you very much. And we've had some new things going on here, which we'll tell you about in just a moment. But tell us about some of the great things that y'all do here.
Well, here at Physical Therapy Center of Ocean Springs and at our Biloxi location, we have physical therapy. We address musculoskeletal disorders, preoperative conditions, postoperative conditions. Our physical therapy staff is residency and fellowship trained. Very few facilities across the country can say that.
Now, you mentioned preoperative. You know, I would think that, yes, postoperative, somebody having knee surgery or hip replacement, something like that. But do you sometimes, I mean, do you have to like get them into shape for surgery?
Actually, if you saw the Sun Herald yesterday, there was an article in the Sun Herald about that yesterday, about the importance of preoperative conditioning to prepare the person to undergo the surgery, which gives them a faster recovery afterwards.
So strengthening those muscles or joints or whatever it is that needs to be done.
Yes.
Now, what range of things do you deal with here? I mean, as far as rehab, so to speak.
Well, we deal with patients aging from 9 to 90. We deal with all types of strains, sprains, fractures, post-operative conditions. You name the orthopedic condition, we address it.
And you have quite a bit of equipment that are set up through here that people are able to come in and use. And of course, you're a physical therapist, physical trainers to work with them on an individual basis.
Yes, they do. Well, you know, we've been here 20 years, so we've got quite a reputation for doing a good job, and we do everything we can to maintain that.
What do you see the most of as far as doing rehab work? Knees or
it's really
a lot of, I'm sure athletes have to come in here and do some work.
We do see a fair amount of athletes, but it just depends. It's interesting. For a couple of months we might see a whole bunch of knees, and then we won't see a knee for maybe a month, and we'll have a bunch of shoulders. It's really interesting. It keeps things fresh, because you just really never know what's going to come through the front door.
I'm thinking knees during football season, shoulders or something like that during golf season, for getting in that golf swing there.
Yeah, and it's typically this time of year we do see some knees. A lot of folks, as you know, will head out west and go skiing.
That's true. That's true. Never done that. Never done. I keep it right here. We'll do some water skiing here. Softer landing than it is on some of that hard
Absolutely.
snow. But again, as I mentioned, with all the different types of equipment that you do have here, if somebody wants to come here, do they need to get a doctor's order?
Yes, in the state of Mississippi, folks can access physical therapy without a physician's order. However, we do prefer to have the physician's order.
All right, one of the things that they've added here since the last time we were here is an aquatic center. Let's check that out. Now, this is something new that you just added, is the aquatic center. And of course, you have your Jamelia as the aquatic trainer.
Yes, Jamela is our licensed physical therapy assistant that oversees our aquatics program. And yes, we did. We added this 10,000 gallon pool. The water temperature is 92 to 94 degrees. This is an official therapy pool. It helps with folks that have any type of disorder from back, hip, knee, ankle, any type of weight-bearing disorder that prevents them from exercising on land. They absolutely love to get into that warm water, which promotes some relaxation and allows them to move with freedom that they don't have on dry land.
Well, in using, in water too, I mean, I learned this when I was getting my certification to scuba dive, is you use muscles in the water to swim than others that you would do outside.
Right.
Absolutely. And there's also a transition that we use with our patients. So the folks that are just entirely too weak to exercise on land, we get them started, and we can get them started in aquatic therapy quicker than on land therapy, and then progress them to land therapy, and then get them back to whatever activities they want to get back to.
I notice you even have a ride over there, the pool dunk.
We do. We do. We have that handicap lift that we have is rated for 450 pounds.
Wow.
So we can get just about anybody in the pool and get them moving.
All right, that's great. Well, this is what they have to offer here at the Physical Therapy Center in Ocean Springs. They also have a new location over in Biloxi, and we need to run down the street there and visit with them here just a little bit. Doug, you also have a brand new location. Well, I say new, a couple of years now, here in Biloxi. Tell us about it.
Yes, we opened up a clinic in Physical Therapy Center Biloxi in downtown Biloxi, right here at the corner of Main Street and MLK 2 years ago.
Now, you were telling me some of the reasons why that you opened it up here.
We did. We saw an opportunity here in downtown Biloxi to participate in the revitalization of downtown Biloxi, as well as the central location of all the large employers in this area, all the casino resorts. That way we can be available to the employees of the casino resorts and their dependents and anything that they need from a physical therapy standpoint. We're here in downtown Biloxi to help them out.
That's awesome. Well, we wanted to talk to the chief physical therapist here at the Biloxi location. Let's go meet Jeffrey. Jeffrey Husser is the physical therapist, chief physical therapist here at Biloxi. How are you? Nice to meet you.
Nice to meet you.
Tell us about some of the work that you do here and the typical patients that you work with.
Well, the typical patients that we kind of see here are musculoskeletal type patients. So patients that have like low back pain, shoulder pain, knee pain, anything with arthritis. Also, we see post-op patients also too. So that helps speeds the process along of their recovery after their post-ops. So those are the type of patients that we see are more musculoskeletal. So getting them back to daily function and stuff.
Give us a little bit of background about yourself.
I'm originally from St. Mary's, Georgia, and I went to Delta State
We
University.
saw the Georgia Bulldogs.
Yep. Yeah, and then I played soccer at Delta State University.
Oh, nice.
And so I worked on my athletic training degree there and also my exercise science degree there before I went to UMC in Jackson for my physical therapy school. While I was in physical therapy school, I also went over a couple places in over the country in Atlanta, Norman, Oklahoma, also in Memphis. So
I've kind of spent some time in Memphis myself in radio.
Yeah, so that way I got to see a little bit of different how people treat it all over the country, a little bit of different methods and stuff.
All right. Well, of course, you know, using a physical therapist when you've had an injury, surgery, or something like that, very important instead of trying to do something on your own, because y'all are trained to know, you know, what to do for knee injury, for hip injury, shoulders, or whatever. Whereas somebody else just doing something may end up injuring themselves a lot worse than what they already are.
And that's a great point. You know, we're experts in how the body moves and in functional movement. So that also helps us. What we do is making sure you're doing the right activities. So you're not, you know, aggravating your symptoms, and you're doing the right things to help alleviate your pain and your symptoms with that. So that's the great thing about us, is that we can see and give you feedback on what's the right, you know, form and body mechanics.
And also give them a good schedule, a regimen of workout at home on their own.
Certainly. When you finish up with us, we'll give you a good home program so you can continue your care, because that's the thing, is that once you get done here, you want to be able to kind of treat your symptoms also if you have a flare-up or anything on your own, where you don't have to rely on a doctor or us to come back to when you do have like a flare-up.
Because the worst thing that you can do is, after you get this done, is go home and just kind of lay around the house and just and
Certainly.
do anything.
That's a great point.
Jeffrey, very nice to meet you.
It was nice to meet you.
Thank you very much. Again, if you need a physical therapist, of course, you know, you have to go to the doctor, or they recommend one. A couple of great choices here. Physical Therapy Center in Ocean Springs, also here on Main Street in Biloxi, and the corner of Main Street and MLK, the Physical Therapy Center of Biloxi. So if you are in need of a physical therapist anywhere here along the Gulf Coast, check with your doctor, give them a call, and of course they can set up something for you, but you do have to go through your doctor first. Get yourself on the mend with both locations of Physical Therapy Center.